Hi everyone, welcome to tonight's career talk and tour. I'm Krista Harmon. I'm from the Kent ISD. I'm one of the career readiness consultants. And our talk and tour is really an opportunity for young people to hear from professionals, hear their personal information of how they got to decide what they're even doing for a career and some of the steps along the way. And we're going to try this virtual format where we'll actually get a little virtual tour at the end of our time together. So we're really excited that you're here today. I want to get started by just introducing Lisa Idema. She is one of the wonderful partners that we have that helps make this kind of event happen. And so welcome, Lisa, and we'll introduce everyone else in just a minute. But go ahead and give everyone just a big picture of what OEM's about.
Sure.
I want you to brag up a little bit.
Yes, good evening, everybody. Thank you for joining and spending time with us this evening. We love doing these talking tours and excited to try it virtually this year and see how everything goes. But my name is Lisa Idema. I'm HR Director at Orthopedic Associates of Michigan, and part of that is the OEM Surgery Center at Midtown. So OEM as a whole has around 440 employees. We have 38 orthopedic physicians, and most are orthopedic surgeons, and treat everything from neck to toe. Tonight we're going to be focusing on the surgery center. So it's an outpatient surgery center or an ambulatory surgery center. So you may hear us use ASC as an acronym used for an outpatient surgery center. The surgery center is orthopedic focused. So it's strictly orthopedics that we see here. We have 4 operating rooms, and you'll get to hear a little bit more about that and seeing some of that as well. They have around 60 employees and treat over 5,000 patients a year. So it's a very busy center. And we have a lot of benefits at an outpatient surgery center. It's more convenient for the patient, it's more cost effective, and you get to go home and recover in your home. So, and we have good outcomes as well. So we are very, very proud of our center and excited to share about some of our careers that we have. We have 3 employees. They'll be here tonight talking about some of their careers and how they ended up here. And we're excited to share a little bit more about what we have to offer. So.
Awesome. Thanks so much, Lisa. So let's do some introductions here. We have Eric Beloy. He's a sterile processing technician, and that might be a career that a lot of young people don't know about. So wave at us, Eric. Hello.
Hello.
Welcome, Andrew Seifert. He's an operating nurse. Hi, Andrew. Welcome. And we have Bridget Visser. She's in the business office side, and we're excited to hear about your work as well, Bridget. So I'm going to stop sharing just for a minute. So thank you for making time to be here. And looks like we have a nice group of students here and hopefully some parents to hear about the work. And let's start off by just, we'll start with you, Eric. When you guys think about back to high school age where some of these young people are, you know, where did you think you'd end up? What were those initial thoughts when you were a high school student, and kind of share that original career path?
At the time, for one, I thought I was going to be an NFL football player first. That was my dream. But secondly, I thought I would be a teacher. And I went to school for a couple of years, but I ended up becoming a young parent like a lot of other young people. So I decided to kind of jump into the workforce at that point. So yeah, I wanted to be a teacher, but I like doing what I'm doing right now too.
So you were thinking about being a professional football player, and we will get back to how you decided on even getting into this whole business. But I love that's where you were and where you ended up. So Eric, Andrew, what about you? What were you thinking back in high school, and how did that evolve for you?
Back in high school, it was kind of suggested to me that I should go into being a journeyman lineman for electricity. And then the program was, multiple year wait. And it was very difficult to get into. And then I had somebody working in the hospital system explain, I always wanted a kind of a set job. I wanted to know that when I got done with school, I would have a job. And the electrician was great, but I knew healthcare was never, there's always gonna be a job for healthcare. So that's kind of when I'm a concrete thinker. So that's how I decided that, so.
Good, and again, we're gonna dig in how you chose being a nurse specifically. Bridget, what were you thinking back in high school?
In high school, I thought I was going straight into college to be a nurse. And honestly, I was very intimidated by that program once I got into school. School hit me harder than I really did expect compared to high school. So I kind of took a lot of different routes on my way, and this is where I ended up, and I'm enjoying it.
And I think it's so great to have you on our panel tonight, Bridget, because a lot of young people, they have a goal. But sometimes life happens, and like you say, you hit a class or some experience that it doesn't work out. So I love that that's gonna be part of your story, is to help them understand that it's a journey. So back to you, Eric. So you were thinking about being a football player. So you graduate from high school, and then you're like, now what? So what were those steps right after high school that you ended up even getting into this? Or what was your journey like?
Okay, so back to the football thing. I played 2 years of football at GRCC. And again, I thought I had big dreams of going on playing football, but in that second year is when my girlfriend became pregnant. So at that time, it just was a weird situation that we were living in. So I decided to kind of put the football and the school on hold and again, get into the workforce at that point.
So had you heard of sterile processing technician before, or was that new to you?
No, not at that point. It was maybe like a couple years later where a family friend had shared it to me, like, hey, you should really look into doing this job. It's not bad. You don't need to go to school at this point. This is like in 2005. So I looked into it and applied, and the rest is history.
That's great. So it was a personal networking situation that helped you learn about it. And that's so great because, you know, there's so many things that we don't know, right? So to have those kind of experiences where someone clues you in, it can lead to a career that's very satisfying. So that's great. So yes, there's things that change in our lives. You didn't expect to be a dad, but you took that experience and you found your way. Andrew, what about you? When you graduated from high school, what were some of those next steps?
The next steps, I started attending the same school that I was applying to go to become a journeyman. And then when I decided to go into maybe the nursing field, there was a 1-year wait. During that 1 year, I decided to go through surgical technology. I wasn't doing anything, really wasn't working at a very good job. So during that time, I obtained my surgical technology because I really liked the operating room. So during that time, I became a surgical technologist. I began making money, more money than I've ever made. And then I was able to work with my schedule with nursing. So I was kind of in the hospital working, paying for school, and my job paid for myself, and I got to work at the hospital. And basically it was like my internship before my internship. And I would have otherwise not gotten into the operating room if I was just a nurse out of school. So
Yeah,
that's safe for everyone, but for me,
well, I think it's a great strategy because college is expensive, right? And so here you ended up being a surgical technologist, which we're going to dig into because I know that's a job that young people don't know about. I definitely want to come back to that. But you started working, you did a short-term training, started working, got the lay of the land, was enjoying it, and then was able to take advantage of tuition reimbursement and get that next level of education. So I think that's fantastic to help young people understand you don't have to do all of it at once right out of high school. You can take that time, like Eric even said, he did some other things and then found his way. Because there's a lot of pressure on young people to figure it all out now, right? What about you, Bridget, when you graduated from high school, you went off to college thinking you'd be a nurse, and then you're like, no. So tell us what some of your thought processes were, because I think that's important for young people to understand some of the decision making.
Yeah, I thought I had to figure it out right away. So I enrolled right into Grand Valley. I was ready to go. The only slight idea I thought I wanted to do was be a diagnostic sonographer, do ultrasounds. So I started enrolling in all those classes, all my gen eds. And then I heard that a couple of the classes for that program were extremely hard. So I was like, maybe this isn't for me. I don't know if I'm ready to really push myself for that. College was a lot harder than I expected it to be. High school was easy. I got to college, and the studying and living on campus was a lot harder than I expected. So then I thought nursing, which is what I always wanted. So I started switching gears and taking those classes, and then I would have had to retake a couple of classes, and I thought I was just set on graduating in 4 years. I didn't want to go any longer. I didn't want to sit on a waiting program or a wait list for a program. So, and then in one of my classes, a professor for the program I went into came in and she pitched it, and it sounded exactly what I wanted. So I started enrolling, and I applied for that program, got right in, and graduated in 4 years.
So someone like for the Career Center, did you say, came in and started talking to you about this other role?
Oh, they just created the program at Grand Valley. It was health information management, and she went around to all like the gen eds for health care, and just kind of introduced everyone to this option. It was new and up and coming, so I jumped on board.
Yeah, so health information is the word that young people need to hear, and it's a hot field, I hear.
It's growing, and their class sizes have doubled since I graduated. So
yeah, and I think again, I know that last time I was at OAM, and I think it was actually a different one of your colleagues also thought she would be a nurse, and then she hit organic chem. And I don't think that was you though. Maybe it was Bridget. but then got into the, data analysis side, and she loved it because she's still part of the healthcare system. And is that what you like about it too, that you can still be part of the healthcare?
Yep, I always wanted to be in healthcare. I was in high school, I got my CNA license, so I was working in healthcare. That's why I thought I'd end up as a nurse, but I just kind of took another route, but I'm still in healthcare. I'm still a part of it. And yeah, that's all I wanted.
And that's why I love these kind of events, because young people can hear about options they didn't really know about, because again, they don't know what might come their way as they get through school and life happens. So to know that if plan A doesn't work, that there is a plan B and that things will work out. So just like for you, Eric, when you think back to that time and you got this recommendation to try to think about sterile processing, and you're like, I don't even know what that is, but thanks for, I kind of dug into it. Tell us about that training then. Like, what were some of those first steps? Were you overwhelmed by that? Was it kind of like, oh my gosh, I'm entering into a new area? Because I think young people need to hear some of that reality of our feelings of uncertainty even sometimes.
Yeah, it was different when I first got to it. Surgery instruments can be overwhelming, like you said, but it's like you can't figure it all out in one day or 1 week or 1 month. It's kind of a gradual process. So like, it's a million different scissors and clamps, and you won't know them all, but if you know one, you might know 10. So it's kind of you pick up little things along the way, it kind of helps you out for the bigger picture. So kind of crawl.
Can I interrupt you? Can I interrupt you for a second? Because I realized there's young people who don't even know exactly what a sterile processing technician is. So I need you to rewind, because I didn't ask you what is it, which then leads to us hearing about the instruments that you're dealing with. Sorry about that.
Well, sterile processing technician is someone who cleans and sterilizes and prepares surgery instruments for operations or surgery.
Yeah. So
go ahead.
No. So when you started doing with all these instruments, there's so many of them that was a little overwhelming. But yeah, go ahead.
Yep. So again, like once I honed in on like what certain scissors were, certain clamps were, certain trays were, it became a lot easier. And now I kind of know most of them that we have here.
So it took some good memory, some practice,
yeah,
some
that's
perseverance.
That's one of my better traits, my memory.
Yeah, and for some people, that's not one of their strengths, so that could be a little tough. So we're going to come back and hear what other kind of qualities make a good sterile processing technician. And but you mentioned training before, and I don't know how it is. So tell us right now, right out of high school, can you get in? Do you have to do a certain certification now? What's that path to get in?
They would like either experience or certification, but our surgery center, we kind of got grandfathered in because we had 10+ years of experience. But it's good to start at the hospital. Like, they are always accepting and willing to try new people.
Yeah, for the young people, I want them to understand this is one of those jobs that you can get right out of high school at 18 years old and get yourself into healthcare. Imagine what an advantage it would be for you to be a sterile processing technician. If you decide you want to be a nurse, you're going to be learning all that in all those instruments, which will make your next level of training. I would think some of those pieces are already there. So I've been talking to, I guess I want young people to know that there's lots of entry-level positions to get in, things like nurse technician or the environmental services, but again, sterile processing technician's a wonderful one too. And I think those schedules are pretty flexible at the hospital, what I've understand. So, so Andrew, tell us what, obviously you ended up with a registered nurse after you became a surgical tech. Do you mind starting with what a surgical tech is? And then also tell us what an operating nurse is all about?
So we'll start with surgical technology. I attained that right after high school. That's an associate's level program. Pretty much from now on, from this point forward, it would be, you would have to have the associate's level or go through a surgical tech program to obtain a job as a surgical technologist. The surgical technologist is responsible for setting up, maintaining, and handing instruments to the doctors. Anytime they say clamp, scissor, and the joke cheeseburger, and they put the cheeseburger in, that is what a surgical technologist does. Along with helping the doctor retract, even run cameras during the procedure, because a lot of our procedures are done through essentially a microscope. So that surgical tech would be assisting in that procedure. Registered nurse, there's so many different fields. Operating room is one of 100 minimum different careers that an operating room nurse or a nurse can go into. They can go into heart center, they can go into the ICU, they can go into the emergency room, they can go into chemotherapy, oncology, anything. There's so many fields. I mean, it's incredible.
Yeah, I've been doing this job for about 6 years now, and man, I have to say I'm a pretty big fan of that nursing career because it is so versatile. There's just so many ways to put that 4-year degree to use, like you said, just all those different environments you were just
Yeah.
mentioning.
For instance, I work in an operating room right now, but I could also apply and work in a heart operating room. I could apply to work in a pediatric. I could work in a, I don't know how much I would do it, but an OB unit with babies. So yeah, you could really go into any field.
So how did you know when you got done with your 4-year degree that that's the direction you want to go? Or how did you end up in the operating room versus some of those other areas?
Well, right after I attained my surgical technology, or actually when I first began, our teacher would take us to the hospital and just observe a case. And I remember going into case, and I'm kind of a blood and guts guy, so when I walked in the room and there's a person with a compound hip fracture, and I was like, this is awesome. You know, they got saws and drills, and it's like working in a workshop. So that's kind of how I knew that was my thing.
And again, for the young people that are watching, that's either like really got them excited, or they're like, gross. Well, but that's what it's all about, right? Is to do some of that self-assessment to start to think, you know, what part do I like, what part don't I like? And then
Who's not in the blood and guts, that's not how it always has to be. There's many different, there's hand surgeries, there's very minor surgeries. It does not have to be like that. So if you're into that, it's definitely available. And if you're not, then do not get discouraged, because there's, like I said, many different types of surgeries, just like there's many types of nursing.
yeah, when I took my parents to want them to have their cataracts done, and there were registered nurses doing those surgeries, and I thought, that's a sweet gig. They work like 8 to 4, Monday through Friday. It's the same procedure. There's no blood and guts. So yeah, nursing, yeah, is so versatile. And Bridget, you had mentioned that was your original thought and passion, but this health information kind of ended up capturing your attention. So tell us more about that.
There's a lot of options once you get into the field. So basically, it's a 4-year program, usually, well, a 2-year, but it's your bachelor's degree, and then afterwards you can get certified. The first one that they usually push you towards is your RHIA, a Registered Health Information Administrator, or your RHIT, a Registered Health Information Technician. It's more of like the technical side of things and the administration of charts and health information. Or the biggest thing that they also push is coding, medical coding. So you can get your CCS or your certified professional coder's degree. And then you can code from home, you can code for a hospital, you can code for, you can get with an outside company, or some people code in office on site. You can get into a management side and you can run a section of a physician's office, you can run a department of a hospital, all in that kind of health record, health information area, where it's really on the back end of all the surgical stuff. They do the surgeries, and once the surgeries are done, we still have to get paid. So we're kind of working on the back end to make sure everything is in line, and we're getting that money from the insurance company so we can stay running and do more and get top dollar for what we're doing here.
Because young people may not understand that, you know, for every part of a surgery or every part of a treatment, there's a little piece that will get billed for, you know, even just the anesthesia, that person has to get paid versus the surgical tech versus the nurse. So yeah, I can see why your role is so important. Your employer needs you to do that well, so that you can get every penny that is due you. And is that why it's growing so much? Because of just how insurance and maybe Affordable Care Act and some of those are functioning now, that there's even a bigger demand?
I think so. I also think, and I think a lot of people look at this field, it's an older generation that's in it. They didn't need a degree at the time when that started, and now that's getting pushed out, and now we're bringing in people fresh out of college. And healthcare is always growing. I mean, there's always new area. There's always, like, the surgery center could be growing in the next 5 years, and there'd be more positions and more to fill out and more to take in. So it is always growing.
So part of the reason, though, is because people are retiring out of it, which is for all of your positions, right? I mean, healthcare, there's a certain number of people that are older now and they're retiring out of the healthcare system. So it's great opportunity for good demand. Does technology, has that changed a lot also in your role, Bridget?
Yeah, so like at the surgery center, we are still paper-based. Most hospitals are not, and we are working to get into an EHR, an electronic health record, which makes the world easier. We're working on a transition right now. So once you're in an EHR, I mean, that's a whole position in itself. You could run the EHR for a hospital. A girl I graduated with, she works from home and she's on her laptop managing the electronic record for everyone at their practice. If you want to, if you can go more technical, you can go more management, you can go more numbers and code. But yeah, definitely the technical side for healthcare is going to continue to change and grow, and we have new programs and anything helpful.
So they should definitely check out Grand Valley's website, for example, for health information systems. That's how they could start to read about this and what some of the options are.
Yep, and Grand Valley and Davenport have the program.
Okay, good to know. So both of those. So again, young people, you don't know what you don't know. So why not read about this option too? So back to you, Eric. What your understanding is now that students, if they wanted to get into this at the hospitals, they might be able to get right in, but they are expecting more specific types of training?
Yes, I do believe it's still an entry-level position, so they're probably kind of selective, but it's still worth a shot at the hospital. But I would say not so much at a surgery center, just because it's kind of who you know trying to get into those, and they want people with experience, and yeah, more experience for those.
I was privileged to take a tour at Spectrum Health where the sterile processing techs were working. And first of all, it has such a nice quiet atmosphere about it because people were so concentrating on what they were doing. Because what happens if you screw up, Eric?
It could lead to bad things, like somebody could get an infection or worse. Like, so you want to be thorough in your work.
So as far as you had a good memory, you have to be pretty thorough. Obviously with those different types of instruments being detail oriented at some level, what other kind of, and for all of you, I'll come to all of you in just a minute. What are some of those then personality traits or work values that you think would be important for a young person if they're going to get into sterile processing?
I would say be flexible because you deal with so many different people. I would say be consistent, be a hard worker, come to show up to work every day, listen, and like I said, just be able to work with different kind of people and be able to work, because it's going to be at a surgery center like us, it's going to be fast paced, you're going to be a lot of surgeries, and you never know what the day is going to present you. So you just kind of got to be ready for everything.
But it's definitely not one that you just have a lot of downtime, it sounds like.
Oh, no. Yeah, I'm here from 7 to 3:30, and I'm walking my 10,000 steps for sure while I'm here.
That's a bonus. Get a little workout with your 10,000 steps. I love it. What about you, Andrew? When you think about qualities that make a good nurse, and maybe specifically operating nurse or even that surgical tech, what kind of qualities are we looking for?
It kind of goes to hardworking is kind of probably the number one. You know, like the old saying, it takes absolutely no talent to show up to work on time. And that's, as far as nursing goes, the morality behind it is that you're here to take care of patients. You're here to take care of, you know, every older person that you come in as your mother, your grandmother. And during that time period, you're responsible for taking care of that person. So every time they go to sleep, you have to assume that that's your family member. You got to treat them. So it's not like, you know, you're just running people through the machine. You know, every single person matters. Every person has a family member. So you have to be compassionate. Yeah, that's kind of what I have to say about that.
How is it being a male nurse? Talk to us a little bit about that, because you're in a non-traditional occupation, or is it changing that there's just that many more men now in nursing?
So many more. I mean, from when I first started, everybody's, oh, it's a male nurse. It's such a great thing. And now I don't even think about it, to be honest. I mean, so
yeah,
I haven't a lot of male nurses. Yeah, I think it's becoming a very gender neutral occupation for sure.
Yeah, I haven't heard the stats lately, but again, when I've been at the hospitals for different reasons, I see a lot of male nurses too. So I'm glad to hear that's not as big a deal anymore. But it sounds like that compassion. And I think the thing unique about your role, and this is for young people as they start to discern what's best for them, is that there are some nursing positions where you do have a very routine and different patients coming through all day, and then you don't ever see them again. Whereas maybe long-term care, you get relationships with the elderly, and you really know them and their birthdays. And then someone like you, has one patient that you have to focus all your attention on. And that's a different really connection as well, that it's really, you're their main advocate, I would think.
Yeah, here we get one patient and they go through the process. And what I like about it is that you're fixing that person and you see like the end result almost immediately. Or sometimes you maybe could see somebody, for instance, maybe in office, and what happens if they never show up again? I don't know, but you could also develop, offices, you can develop a friendship with this person, or in a long care setting, you could be there with them to their last day, which is also another, like I said, there's so many different, it's all about what you want to do. And as you go through your nursing program, you'll figure out whether you want to do the operating room, or you see your person one time a day, or you want to be in a long care facility where you're there with the end of the time. You can be in an office where you develop friendships, or you can be at a pediatric center where you can kind of fill the void of maybe where there's a parentless situation or a child needs your help, and you can kind of fill that gap. So you can kind of pick whatever you want to do.
And just to help young people understand, the 4-year degree is kind of a general, and then you get it in and specialized training in a different department or setting. Help young people understand how that works.
So when you get done with when you're in your nursing, you begin what's clinical, which is internship. So this goes back, I'll touch on the hardworking part and I'll get back to that. So every day you're in your clinical rotation, you are being watched and you are being graded. Not like a test, but every department you go into, you're basically trying for that job. So you'll start off on like a med search floor, which is like any other hospital situation, where it's just kind of anybody from flu to just being overall sick. You can go into the emergency room. We go to the ICU rooms. We go to the pediatric hospital, the OB units where they're delivering babies. And there's also psychology units that we go to, and long-term care facilities. So every step of the way, there's not one really stone unturned there. So,
And like I said, for you, that being a surgical tech was one of those key pieces for you, that's where you knew you'd want to be because of that experience. Yeah, that's great. So Bridget, tell us what kind of personality traits or work values might be really important for your type of work. What kind of characteristics are we looking for?
I'd say the biggest one would be attention to detail. From what I can speak on working here, you're mostly dealing with insurance companies, and we're on the front end and the back end. So before a patient can even come here, we have to make sure that we'll get paid by their insurance. And then on the back end, we have to make sure we have all that information correct, or else they won't pay our claim. So for instance, anyone over 65 has Medicare, but Medicare won't cover all procedures. So we need to make sure we don't have someone come here getting a procedure done that Medicare won't cover. So it's just, there's a lot going on the back end that you're watching for. And same with filling out, a lot of times we get a rejection for having the wrong diagnosis code that goes with their procedure. So we're fixing those little details, or else honestly you don't receive anything in return. And then you basically do a free surgery, so that's never good.
Yeah.
For other areas, if you go into medical coding, again, that's attention to detail too. You're reading op reports and finding exactly what that surgeon did. 3 pages worth, you might have done one procedure code that you're nitpicking through the op report to find exactly what he did in that OR to get paid on. In other areas, if you go into like an EHR setting, I mean, it's really just detail. You're dealing with all the nitty gritty back end, behind the scenes stuff, and being patient with it as well. And consistency, I'd say. When it comes to trying to get paid by insurance companies, they will do whatever they can to ignore your phone calls and ignore your claims and your appeals. You got to get on them and you got to appeal as often as possible. There's usually a 30-day gap, and in 30 days, you better be calling them again, or else you're out the window and they're not going to pay attention to it. So you got to stay consistent.
So some of that assertive communication.
Yeah.
Yeah, in general, my personality is very people-oriented. I'm not very good with routines and structure and that consistency, so none of your jobs would work for me. I am very improvisational, and so I think that's why I want young people to hear some of these things so that they can start, like I said, to start to think, oh, that would work for me, or that would not work for me. Because if we, I mean, there's so many jobs out there, if we can start to narrow it down, right, that makes it a little easier. So I'd love to know what your favorite part of your job is, and what the biggest pain is. So we can start with you, Eric.
My favorite part, no weekends, no holidays. Oh, that's a beautiful thing. And we get bonus checks. Yeah, that's my favorite part. My least favorite, the blood and guts don't really do it for me. So when the stuff gets clean, I'm more than happy with that.
I love it. That's great. And I mean, a schedule's a big deal. I mean, there's some jobs that you're working all the time, weekends, holidays. I had a friend who was an OB doctor, and she every Christmas was at the hospital, right? And for her, that was tradition, and that worked for her over time. But yeah, it's that life family balance for sure. How about you, Andrew? What do you love about your job?
I want to go back to you because I got a job opportunity for you here. So you said you don't like structure or anything like that. So travel, they have travel nursing for long care facilities, so hospice. And let's say you could have 5 patients. You could select how many patients you want a day. And let's say there's 3 patients in Grand Rapids. You have to travel there. It doesn't matter when you go there. They just have set hours. You drive in the morning, then you go in the afternoon, then you go at dinner time. You can select how you want. So I got a job for you. So
Yeah, but still the procedures, what you do with the patients is still pretty procedural.
Yeah, half and half. So
I'm a little ADD that way. Like, hey,
okay.
Wait, did I do that part or not? Yeah. So as far as your favorite part?
My favorite part about my job is always the ever-changing. I have different surgeries every kind of day. I see different people and different things obviously happen. Nothing is set in stone of exactly what's going to happen. I like to be able to critically think or be the kind of person who knows what the right answer is. Because at the end of the day, I mean, we are the last line of, I mean, there's nobody else you're going to ask. I mean, there's not a help desk line most of the time for what do we do? It's you're the one who knows. So I kind of like being the backbone of the surgery of how it's going to go. So then the worst part what I dislike about it, I don't think I have a worst part. I mean, sometimes people, I guess. I mean, that's everywhere though.
Patients or coworkers?
Coworkers, more than yeah. They're all good here. Yeah, all good here. It's easy.
Well, that's a blessing.
It's hard to fix friendships. I don't know.
Well, that sounds like that's a win-win to like so much of your job. That's fantastic. What about you, Bridget?
Basically, you kind of just see a reward for what you're working for. So when I first started here, my first claim I was given that wasn't getting paid was in 2016. I started here 2 years ago. So we weren't getting paid from a claim 4 years ago, and I did everything I could against Medicare to get them to pay it. And it's rewarding to know what you did help this whole center. So we got money that we weren't going to get because they didn't think that they deserved to pay it, and I was demanding that they did. So
Awesome.
That's fun. You can see you can see your progress. You can see the results of what you're doing. Nothing goes unsaid or unthought.
That almost seems like almost like a little game that you might play in your head.
You want to win.
And what about the parts that maybe you don't like so much?
Insurance companies are really frustrating to deal with because they don't want to pay anything, especially workers' comp.
Thanks for sharing that. Sometimes students, when they hear you guys talk about your jobs, it can actually be a little overwhelming to them. They're like, oh my gosh, that's so much. Like, I don't think I can do it. So I'd like you guys each to answer, like, how did you know, like, what was it like at the very beginning? And when did you start to really have the confidence, like, I know this? How long did that take? So Eric, let's start with you.
It takes a little while, but I would say what I like about that, I like when people come, that's how I know my job I'm wanted, is because when people come and ask me for something that they need. Hey, Eric, do you know where? Hey, Eric, could you find? That's kind of gratifying in itself. And like, I kind of thrive on that. Like, I kind of wanted, when people were asking, I didn't know, I would look and make sure that I would always remember it, or put that stuff away to remember it, just to kind of be counted on in that manner.
So being the go-to guy, that's something that is very rewarding for your job. And so like you said earlier, it just took some time for you to learn all the different instruments. And I guess I just want to encourage young people that that's just part of it. It's just, you don't know everything all the time, and you just have to start at square one and start moving forward. So I love that you're at a place that you're the go-to guy. How about you, Andrew? Like, just, when you're fresh out of nursing school, or even maybe when you were just a brand new surgical tech in that operating room, what was that feeling like, and how long did it take for you to get to feel comfortable?
Well, to set people's mind at ease. I would say every single time that you will have a preceptor that's with you. They will kind of be with you like from day one. They will never really leave you. They're basically, you're a part of them until they have signed off that you've obtained a certain set of skills and you're competent enough to do this. And you're not going to walk in the first day and they say you need to go down to the OR room 1 in this big case and go by yourself. That's really never going to happen. So that person will always be there, especially at OAM. We have a big giant binder. And as the procedures go on and you've seen certain types of procedure and you've demonstrated the necessary skill set to practice on your own, then that's kind of, we let you spread your wings. And then we have a preceptor that follows maybe kind of like a shadow. So maybe they won't be in the room, but they'll be kind of helping in other rooms, but they'll always be your backup. So as you do begin, you have to be very detailed in as far as retaining it. You know, you might see 1 or 2 procedures of this kind, and then you might not see them later. So it is necessary to take notes, and that's pretty common if you see in the hospital. They all have notepads, and they're always taking notes. And that's, you know, like I said, I mean, there'll be times where there's procedures that I've never seen before, and I have to take notes on them because who knows when you could see them again. Sometimes we have procedures here that we do 1 a year, and the chances that you're going to be the next one to do it next year is probably not common. So it could be 2 years down the road that you see this procedure, but it goes back to being detail oriented and kind of trusting your skill set, or at least giving yourself enough notes to be competent in it.
Yeah, and also that you're never alone, that there's going to be someone who's training you, who's supporting you, who you can ask a question to. I think that's important for young people, and that word is new to a lot of them, probably that preceptor word. That's a very, I hadn't heard about it till really I got in this role working with healthcare, that preceptor. So it's great, young people, you learned a new word today.
Yeah.
So Bridget, with your role too, obviously when you were early in college and you realized, man, this nursing program, that's not for me. And so you knew enough that you're like, made a different decision. When you got into health information, did it seem to be like a duck in water? Was it frustrating or hard too? Kind of tell us those feelings and how long it took to feel comfortable.
Yeah, I mean, I still feel overwhelmed with the field because there is so many different options that I might not even know about at the moment. Basically, what I would say is any certification you think you want, go for it, because the more you have, the better it will help you in the long run. Right out of college, they expect you to take a test to be registered. I waited, and I definitely regret that because now it's like you have to go back and start all over almost and restudy. And when you had it all fresh at the time, it's right there for you. I mean, alphabet soup behind your name never hurts. So the more certifications, the better. And then whenever something comes up that you think you might be interested in, you're already qualified for it, or you already have that certification that they're going to require from you. But honestly, for me, experience is everything, and that just takes time. So you learn as you go.
Yeah, I think it's important for young people to hear that, you guys. Thanks for sharing and being honest about that. Those certifications that you mentioned, Bridget, and probably this for you guys too, for Eric and Andrew, is that something your company pays for? Do you have to pay for those certifications out of your pocket? How does that work? We'll start with you, Bridget.
I know here they offered, so if I went and got coding certified, they would reimburse me for that. I think as long as it's within your role or your position, that they would encourage you to better yourself, and they would reward you for that.
How about you, Eric? Any certifications that would help continue to build your resume?
Yeah, it is. So it's sterile processing certification, but COVID kind of jacked everything up, and so it's not. Yeah, I'm not set to take it, but right away. But I do plan to take it at the top of the year, though.
Yeah, and again, the company will pay for that.
Yeah, if like Bridget said, if when you take it and pass it, they'll
Okay, they'll reimburse you. Yeah, that makes sense. Andrew, have you had to take additional certifications since your bachelor's degree in nursing?
I have. I continue to have and have in the past. So there's many different certifications. I mean, there's so many of them. Here at the ambulatory center, we suggest that everybody get their certified operating room nurse degree, certificate. Just specialize that you are not only a nurse, but you're a nurse that is certified in the operating room. There's really no certificate when you get out of nursing school that says you're in the operating room besides the training that you've received. There's also the Blue Care Distinction Leadership Program, which certifies that we are able to, and we specialize in total joints. So I've also volunteered for that, and OAM has reimbursed me for that certificate. And I I just thank them because I'm able to add these, you know, alphabet soup to the back of my degree, and they pay me for it, and I get to continue to have that behind my name for free of charge. And normally I would have to pay for them myself, which is, like I said, any opportunity you can to better your career or better your name is well worth it.
Yeah, that's great advice. We're gonna go on a tour in just a few minutes. So I want to just ask maybe one or two more questions, and then we can head out for the tour. Sometimes students like to know, like, well, I think about, especially operating nurse, Andrew, like, what is similar to TV and what is like a total myth? What are some of the myths about what your work might be? And for the rest, for Bridget and Eric, you can think about that too. But we'll start with Andrew on this one.
A myth in the operating room. I don't really watch too many of those because they're kind of hard to watch, being in the professional setting.
Because it seems so silly.
Yeah, I don't know that everybody, they're always coding in the operating room, and they're always, you know, they're always flatlining, they're shocking them, and it's really not. There are situations where that can happen, but it seems like every person that goes on under the table is flatlining in the shows.
So you think it's kind of silly. So that what they see on TV, we want young people to know is just really not how it is.
Yeah, you know.
More calm, more orderly.
Yeah, it's when it gets crazy, it gets quiet. That's the interesting part. So it's normally pretty relaxed and we're having conversations and focusing, but it's when the room begins to get very quiet and the doctor starts talking and the nurse, you know, the radio goes down, you know, that's when it's actually getting more serious. So normally it would get really hectic and everybody's yelling, but it gets very quiet.
That's interesting. I had not heard that before. Anything you would want everyone to know, Eric, about your job that maybe they might make assumptions about that you'd want? This is your chance to actually sell, like, why they should consider it. Give it your sales pitch versus what you think they might know or not know. Although I think that's new to a lot of kids.
It's not a bad job. It's not as physical as some may think. Like Andrew and Bridget were saying, it does take attention to detail. But I would say one myth would be, like what you see on TV, is that nothing goes wrong. Everything goes right on TV. All the trays are ready. The batteries don't die in real life. Batteries do die. Sometimes trays are not ready. A surgery might have to be delayed 15, 20 minutes for things to work on time. Like Andrew was saying, if people are getting quiet, then you want to worry. But if not, everything kind of runs on time the way it should be. It's perfect. It's a good job to have.
Do you ever actually go into the operating room, Eric, or is it mostly behind the scenes?
Sometimes I have been, as of late, going into the operating room to help out and assist if they have any questions about a tray or instrument, and I can help them out.
Because we all work together. And that's the thing about healthcare, is that every team works. If Bridget doesn't get the patient ready to approve the insurance, we can't do the case to begin with. If Eric doesn't do the instruments correctly, we can't do the surgery. Everybody's really relying on, and everybody has to do their part, and you kind of rely on everybody. So, and when when OEM does 5,000 plus cases a year, it shows how efficient and how well we work together.
Yeah, I've heard that about healthcare, that teamwork is so critical. Bridget, what about you? Is there anything that when you hear about medical records or health information that you think people think about your job that's not true?
It's not just a desk job. My position right now is a desk job, but there's more out there than just that. You can be on your feet all day. You can be managing. You can do a lot more than just be at a computer fighting insurance companies. I do want to say that. That's what I do personally here, but there's more than just that out there in this field that you can go into and specialize in.
And then one of the students asked about salary, and that's certainly something they could do some research after this, but could you support yourself on it? Are these the kind of jobs that you can pay your bills? I mean, because I know the wages seem to be changing, but there's some jobs that it's just like $9 an hour, $10 an hour. Anything you guys want to say about salary? Again, we're going to encourage the students to do some research. But.
Yeah, do your research. Obviously, the more years you have experience, the more you get paid. I have a 1-year-old at home. I have my house paid for, and I don't. It's all about how you spend your money, to be honest. I mean, that's money management is another key thing. But I feel like I'm heavily reimbursed for what I never dreamed I'd make this much money in my life. So.
And I feel like for an entry-level job, or so to say, it's definitely a good living. It's teacher salary. So it's not bad. Like, it's what you make of it, like Andrew said, but I make pretty good living, I believe, for me and my family.
And one final question before we take the tour. I know that Andrew kind of started as a surgical tech, and there was something that he saw in that job that he aspired to then be a registered nurse. Do you, especially Eric and Bridget, do you see something else in your future? Is this like, this is working for me, I don't need to think about, but what kind of career path do you see? Because you're both pretty young. You know, what are some other things you aspire to, Eric?
I really like my job here at OEM, and if it were for me to leave or do anything different, it would probably be a sales rep or something. I would shoot for the stars, you know what I'm saying? But besides that, I would probably, the nursing, and I just don't see it, but like I said, I'll probably stick with instruments, but it'll probably do something like that. So
Yeah, that's something that young people don't even think about. I mean, the sales people who sell the equipment to the hospitals, that's pretty lucrative. It can be.
Yeah.
So that's interesting. And with your expertise, yeah, that's an interesting thought. And how about you, Bridget?
So my job here right now is a pretty entry-level job. I came in as a float. It was my first job out of college, so it really helped me take the textbook and put it in real life. And the whole point of the float is to see everything full circle, and if they need help in a certain department, I'm getting pulled in doing that. So I really get to see full circle how everything works on the back end mostly. I don't get into the OR or anything like that. And then even doing that, everyone's kind of like, so what do you like better? Like, would you go more scheduling route? Would you go more billing route? Would you go more coding route? From here, I think my next step would probably be getting coding certified and being a coder for medical. I mean, medical coding is the language of the medical field, honestly. There's a lot to it. You're doing diagnostic. I mean, it's the language between all parties.
And like I said, I've heard the demand is definitely there for all three of your positions for sure. Well, it's about 20 after 6, so why don't we take a little tour and see what it's like behind the scenes at the surgical center at OAM.
Yeah, so I'm going to switch to my phone. So this is going to be the OAM name.
Sure. So all of you that are still on the call, this is kind of a new thing for us. We'll see how this goes. If you have any questions though that you'd still like answered, go ahead and throw them in the chat and I'll be sure to ask.
Okay.
Okay.
You want to take it?
Yeah.
I'm just gonna get out of
So this is our way back into the operating room. As the surgery suite, as we go back, it's an actual restricted area, so you can't get back into the operating room without having the proper clothing and personal protective equipment on. If you were at normal business hours, you would be pretty evident quickly that you were in the wrong area. So as we come in here, this is one of our operating rooms.
Yeah, take us.
This is a normal standard operating room bed here. We have a fluoroscopy device, which is actually an x-ray machine. And over here we have anesthesia machines, what keep people put to sleep and stay asleep. And these are just a number of different, this is a camera machine that's basically like a microscope inside the procedures here. So over here, Eric's going to show off some of the instruments.
So this is surprising to me. It actually
This
has
is,
could you hear me? It has a lot more equipment in there than I thought. It seems crowded. That's not what I expected.
volume.
I
Can you
guess
hear?
Can't hear me. Yes, I was asking a question, but that's okay. We'll just let you do your tour and I can ask
Okay.
questions at the end.
So this is actually an ACL, which is anterior cruciate ligament reconstruction set. So this is actually the same kind of sets that if you were a football player or an athlete, this is the exact same set that they would use to reconstruct your ACL. So this is pretty standard. So if you went across country, you'd probably see the exact same set being worked on, any NFL athlete or a basketball player.
So we drop from our side of the thing, we drop indicators in here to make sure that the tray is sterile. So this starts out all white and it has to pass that green line to be accepted for surgery. And we put another one on there and make sure.
So then this is a It might look like a very simple drill, but this is, or a saw, but these are a couple $1,000s a piece. So we take very good careful to protect these instruments. And everything. Any questions so far?
I think it's really helpful to show us an actual set of equipment that you're using in there. Now, you said that's an actual operating room?
This is an actual operating room. Yeah, tomorrow at 7:30, we'll have a patient in here and having surgery on it. So
I was saying earlier, it seems like it's kind of smaller than expected or more crowded than expected. Tell me how many people are in there at a time and where people would be kind of stationed.
you know, that is a common misconception that the operating rooms are large. This is actually a pretty standard, and I've heard that this is actually a larger operating room than normal. So in the room, there could be anywhere from 4 to 5 people in the room, sometimes more, but we do keep an eye on how many people, and then overcrowdedness can obviously increase the chances of break and sterile technique or even an increase in infection. So at the top of the bed, we'll have an anesthesia provider, such as an anesthesiologist or a nurse anesthetist. So this is a nurse that has attained a master's in nursing and has gone on to and studied an additional 2 years in just anesthesia. So they're certified registered nurse anesthetists, which is another path in nursing. Over here, we start to have, this is where the circulating nurse, where I like to hang out, and this is that area. And then over here, the table, this would be draped up with the patient would also be draped, and that's where the surgical technologist in the operating room surgeon would be operating there. So there's always most times there's a physician assistant. So that's where we kind of get that 4 to 5 realm of how many people are in here. So I'll get to the back of the corner because I want to show off all the real estate. So
I'm getting some really positive feedback from the students. They're very appreciative that they get to see this inside, because even in our past talking tours, I don't know if we got to go in the actual operating room because of, making sure it stays sterile. So that's really awesome.
Yeah, that most people don't ever get to come back because of you have to actually put on, when we come to an operating room, we have to wear the scrubs that are provided. So they've been laundered to make sure they're clean and tidy and to reduce the bacterial count. And then obviously nobody knows what the operating looks like because most of the time they've been administered medications and they don't really remember what it is going back here. So it's that's another cool thing I like about working in the operating room is that I get to be back in the place that nobody knows anything about, It's like, what's the cockpit of an airplane look like, pre 9/11?
Yeah, I think that's very fascinating. So I'm just asking the students if this is prompting any questions for them. So we'll see if they have one for you. But like I said, for them, it's very exciting to be able to be behind the scenes with you guys. So surgeries, length of time, typically, half hour, 2 hours, 10 hours? What do we got going over there?
I've been in surgeries that are 10 to 15 minutes. Not at this facility, but I've been in procedures, yes, that have been excess of 10 to 12 hours. So obviously,
how do you do that? Like, what about going to the bathroom and stuff?
There's we're very fortunate at OAM. We always have it's like Bridget talked about, she's afloat, so she transfers from station to station. We also have a float RN, and their job is they're also a circulator, but they will go in and break. We get breaks in the morning, in the afternoon, in the evening. Now, for that specific case, not this facility, but for 12 hours, you get a nice breakfast and, no coffee, no water, because you got to use the bathroom. So you got to make sure. And if you need to get out of the case, they will do that. Absolutely. But at that point in time, I kind of wanted it was a personal vendetta that I wanted to make it through a 12-hour case. So
your personal goals.
Not asleep. Make sure you get 8 hours of sleep before you do it.
That's great. I have a couple questions from the students. One is, do you ever get nervous before surgeries?
I'm sorry, I missed that.
That's okay. Do you ever get nervous before a surgery?
I'm more excited that I get to partake in it. I guess you could always be nervous. It's always the unknown, but that's why you're always on your toes that, like I said, you're the person that's going to take care of them. So you got to be on your, be on your toes and be ready for anything.
And just as we kind of I don't know if there's any other space you were going to show us, but I think if you could just give us just a general rundown of just the process. So you get things prepped, you bring in a patient, and then kind of what happens after. If you could just give us just a quick synopsis of what happens before and after.
Had surgery from that point forward? Is that what you're?
Well, even, wheeling the person in. I mean, when do they go under anesthesia? Is it once they're in?
Yep. So a lot of times back to misconceptions. A lot of people think that they are asleep before they get into the room. The medications that they give you have an amnesic effect to them. So even though you are 100% conscious when you're in the room, but you forget about it later. So what happens is once we get you all ready, we have your IV. You've been cleared for surgery. The doctors talk to you. I've okayed everything. We wheel you into the operating room. I'll flip the camera around here. Okay, so then we will right up to the operating room bed. At that point in time, we have you get onto the operating room bed. The anesthesiologist will then administer the IV medications that will put you off to sleep. At that point in time, we will cleanse your legs with some type of antiseptic, which is a surgical grade antiseptic. And then at that point in time, the surgical drapes will cover your entire body except for the part that is being operated on. Surgery progresses on, case closes, the doctor puts the sutures into you, close you up, and then we put dressings on. We ship you off out of the room, go down the hallway, and you enter in what's called the PACU, which stands for Post-Anesthesia Care Unit. So that's a very quick rundown.
Yeah, that's great. That's very helpful. For someone who hasn't had surgery themselves, they wouldn't know how that works. So thank you. And so just to recap, there's a couple questions coming in now, but you mentioned, so your role as an operating nurse, you have a surgical tech, you sometimes have a physician's assistant, you obviously have the surgeon. I guess I want young people to know at the anesthesiologist that there's so many different roles that make a surgery happen. Because sometimes young people think, oh, I want to be the surgeon. But with that commitment to school and just a level of intellect, not everybody can be a surgeon, but you can still be a critical part of this team. And I think I really appreciate you guys showing that today. We're going to do 2 questions and then we'll wrap it up. But someone's asking, what have been some of the main complications in the surgeries?
Complications. We never say the D word in surgery, but that's always a possibility. Never here at OAM because we are an outpatient center. The people that we come into are healthy. They're planning on going home. All of that things. But if you work in a hospital and somebody comes in and they're very acutely ill, there's always that. There's extreme blood loss. We do mass transfusions, is what we call them, when somebody's losing so much blood that we basically, we're just putting in a lot of fluids. People can start to develop abnormal heart arrhythmias. But a lot of those things are cleared up before you go back to surgery. Even if you're in such a very emergent situation where you're injured so bad, there's also the complication that they won't even put you to sleep because you're so unhealthy,
That's helpful.
You have to be somewhat stable to even go back to surgery.
Yeah, I appreciate that for sure. But again, there's so many different types of surgeries, so many different parts of the body. So there's obviously different risks for different surgeries and the condition of the patient. And then for you guys at OAM, a lot of knee replacements, hip replacements, broken bones, that's the kind of stuff you guys focus on. What's your most common surgery?
We do a lot of diagnostic knee arthroscopy. So a diagnostic knee arthroscopy is we take this machine, one of the machines, and it's basically hooked up to a camera we call it a microscope, and that will go into the leg percutaneously. So that means that it's a very, very small incision. They'll look inside your knee and they'll diagnose what's kind of happened in there. That could be, if anything, from the development of arthritis, to a torn ACL. So diagnostic knee arthroscopy, I would say, is one of the most common. But we do a lot of shoulders and ACLs. I guess when I say it's the most common, it's because it takes the shortest amount of time. Knee, ACLs and shoulders take multiple hours, so you can only do so many of them in a day. But I would say shoulder arthroscopies is probably the next one. Rotator cuff repairs.
That's something that students can do a little research on too. You know, Google that. It'd be fun to read what's the most common surgery out there. I think those cataract eyes probably right up there too.
Yeah.
So we're gonna finish up. I do want to, I don't know if Bridget's still in there with you or Lisa too, but maybe just a word of wisdom. When we're done, I'm gonna let you guys know that I'm gonna stop recording it, and then I'm gonna offer a few resources for the students so that they can continue on with some exploration. So what, is Lisa still there?
No, we're now in the restricted area, so.
Yep, that's
I do
cool.
want to show SPD before we go, if that's okay.
Say that one more time.
I do want to show SPD, the sterile processing department, before we go.
Absolutely.
We never
No,
went
that's,
there.
no, please. I didn't know if you were going to go anywhere. Go ahead. So
Yeah,
as you're
sure.
walking, can you hear me, Andrew, as you walk?
Yes.
Have you ever, as far as your tenure at OAM, have they ever allowed students into job shadow?
It's kind of a touchy subject, especially right now with COVID. That is difficult, but I'd have to get back to you on that. I know you have to be at least 18 or pursuing it. You know, we just have so many people, and the operating room is such a, it really is it's a restricted area. It could be extremely dangerous for somebody, not only more so to the patient. So we're very protective of our patients.
Yeah, I think that's a good reality check, though, that this is really for students who are medical students. I mean, it's really such a valuable and high priority of a job shadow that high schoolers are not gonna be able to do it. So I just want to give them a reality check on that. It's not, you're not gonna be able to get into an operating room because first of all, you have to be 18. So this is your
Yep.
Eric.
This is my
area.
area of operation. This is what you're looking at is a sterilizer. This is one of our small ones. This is our big daddy right here. Where it really gets done. Every tray, everything that's being used inside of a surgery that's instrument wise has to go in these sterilizers, and it gets cooked up to 270 degrees for 4 to 5 minutes before it becomes sterile. These are a couple workstations, one right there, a big silver one. It's 3 of us that work in here. So it's 2 workstations on this side, one there, one here, some trays. These are sterilized trays, which you can see the lines on them. The tape is turned black and white. And this is our sterile storage room, where it's all the trays that have been wrapped up and sterilized already. That's just waiting for surgery to go. So that's what I was referring to when people come in and ask, hey, do you know where a camera is? I got to be able to locate a camera and tell them exactly where it is so they know and can use it in a surgery in an emergency type situation.
Like you said, Eric, that takes a lot of learning, like you say, to really know those areas. And like you said, it's so critical to the success of those surgeries to know where things are and that they're sterilized and ready to go.
Yeah.
Very interesting. Any students, do you guys have any questions for Eric in that area of I guess a surgical center? It's not a hospital. Although you wouldn't know that, right? When you're in the patient rooms and all, you wouldn't know it's not a hospital. Everything is the same as far as. That's great. Are you guys planning on going back to that main room, or are we going to end it here?
Yeah, we can make our way back. Yeah.
Okay. I did not ask Lisa for permission about your emails, so I'm just telling the students that if they have a question that they'd like to ask you personally to follow up, just to email it to me, and I'm going to share my email at the end, but I'll also put it into the chat, and then I'll forward it on to you guys.
Any questions that they may have or whatever, you know, they can just send them, I believe, to Lisa, and then Lisa will be able to kind of vet them to us, and I'll do my best at answering them best I can.
That's great. I'm going to turn the video back on in that room. I turned it off. Basically, my last question, you guys, would be for you just kind of share a word of wisdom, and I can repeat that once you get in the room. Hi, Lisa.
Sorry.
That was really great. You guys, the students loved it. We even someone said here that now they're inspired to really look at surgery and be a surgeon. Like, this is very inspiring to them. A quick question though for you, Eric. someone wants to know if you've ever dropped a tray, or I guess Andrew for that matter.
I have for sure. I've dropped one with like 1,000 screws in it, and the person that helped me out, I was so thankful, but it kind of ticked them off a little bit. I'll say that.
Well, it goes back to, you know, when they say, oh, they come running in, they say, I need a tray. It happens all the time. I've been doing this for 10 years. I know what I feel like I know what almost every instrument there is. And I still come back there because I know that Eric's the fastest guy getting them. And I could probably find them, but when you're rushing, you know, you're in a case, you want to get it, and you know that, you know, you rely on your resources. So yes, I've dropped the tray, and yes, I've run in that room saying, where's the tray at?
Yeah, that's great. Well, like I said, I'm going to have you guys give a final word of wisdom to these young people as they explore to figure out their careers. And then when I stop the recording, students stay on because I have a couple of resources to share with you. So we'll start with you, Eric. What would you like to share out for these young people?
I would just tell them to keep going. Like, even if sometimes life's hand you a bad set of apples, just continue to push through. If you want to get involved in the medical field, it doesn't all have to be doctors and nurses. You could get involved in an entry-level position and maybe work your way up through a tuition reimbursement or see what programs or whatever your company may offer. So it's always light in that tunnel. That's what I would like to say.
That's gold right there. How about you, Bridget?
If you can job shadow, it is really helpful. In high school, we had to do a class, and I job shadowed an ultrasound. That's what I originally thought I wanted to do. I thought I would see babies all day, and I job shadowed an ultrasound, and I never saw one baby. So that was a reality check on what that job would actually be like. Kind of like Eric said, started at entry level and work your way up. I thought I was going to be a nurse, so I started as a CNA, loved it, got to school, things changed a little bit. But you can do whatever you set your mind to. So as intimidating as it is, go for it if you want it. If you want to be more comfortable, like it is what it is. I would say go to CC for your gen eds. Grand Valley is expensive.
Yeah, I love it when some of our experienced people have, for really encouraging on people to save that debt and get those 2 years of general requirements out of the way at a much cheaper price. Yeah, that's a good tip. How about you, Andrew, to finish this off for tonight?
This is always like my favorite part. You know, they say, you know, it is about kind of what the school you got to go to, but me going to a Kirtland, which is a community college up north, I have the same registered nurse degree as somebody who went to U of M, Grand Valley, any college. I have the same degree, or I should say I have the same licensure. I'm able to practice the same way as any other nurse. Secondly, anytime you're doing an internship, whether it's you take a day off school and you job shadow a job, you are training right then, you are being watched, you are interviewing every person. If I have somebody interviewing with me and they're walking behind me and they're not right on my feet, I know, you know, I don't want to, oh, come on, you know, you're always interviewing for a job, no matter where you go, there's always a set of eyes on you. And then lastly, anytime you have the opportunity, if you have somebody in your life, such as parents or guardians or anybody in your family that's able to kind of mentor you or help you in this time, this is the most important time between the now and the next 10 years to really set yourself forward. So, you know, if you're going to go to a university, that's totally fine. If you want to go to a community college, make sure that you're working and you're always studying, because it only gets harder from this point in time. So it will never be easier than the next 10 years in your life, or I should say next 5 years from high school on. It will never be easier. So get as much as you can done, study hard. And really, nobody likes to study. So just when you say, I don't like to study, just get that out the window, because nobody does.
Yeah, that's great advice too. You guys are awesome. You've been awesome. This has been a lot of fun. And Lisa, thank you again for your help setting this up.
Yeah, thank you.
We really appreciate your time, you guys. I hope you have a really good evening. And I'm going to stop the recording and, like I said, give these young people some more resources. So we'll follow up if you want to do a one-on-one career chat. We'll talk about that, because that's our virtual job shadow right now, right?
Yeah.
Thank you so much. It was nice meeting you again.
Thank you.